everybody high, also often invisible, chronic pain is everywhere. It's not only debilitating, it's expensive, both in terms of medical treatment and lost productivity. In her new book, Mind Your Body, a revolutionary program to release chronic pain and anxiety, psychotherapist Nicole Sachs introduced a groundbreaking method to eliminate not just chronic pain, but also conditions like long COVID, migraines, irritable bowel syndrome, fibromyalgia, chronic fatigue, and more. While medications, physical therapy, supplements, and procedures often fail, her approach centered on a target writing technique called JournalSpeak offers a promising path to recovery. Sachs grounds her methods in the principles of mind-body medicine, a paradigm that recognizes the deep impact of repressed emotions and stored trauma on physical, psychical health. According to this model, many psychical symptoms, thought real and painful, are not necessarily rooted in structural abnormalities. Instead, they may result from a condition known as Tension Myoneural Syndrome, TMS, an umbrella term for chronic conditions that don't resolve by treating only the symptomatic body part. At the heart of TMS is nervous system dysregulation. Our brain, in an effort to shield us from overwhelming emotional pain, grief, rage, terror, shame, activate physical symptoms as a form of protection. This response is reflexive and unconscious, triggered when the emotional reservoir we all carry begins to overflow due to stress, trauma, or life-changing events. In these moments, the nervous system perceives emotional distress as a greater threat than physical symptoms. It switches into survival mode, fight, flight, freeze, or fawn, and send out pain signals to divert attention and create safety. For example, that back pain that puts you in bed for the day. It may be your brain's way of slowing you down, giving you an excuse to cancel plans, draw boundaries, or finally ask for help. The pain is real, but its origin is emotional, not physical. And that's the fascinating part. All pain is created in the brain. Even when you burn your finger, your brain must interpret the signal and generate a pain response. With TMS, the brain sends pain signals without a physical injury, using pain as defense strategy. Such treatment approach has three key components. Knowledge. Understanding the neuroscience behind chronic pain is critical. Patients must see enough relatable examples to genuinely believe this is what's happening in their body. JournalSpeak. This is a 20-minute, unfiltered writing practice that allows individuals to express their most raw, irrational, and repressed emotions. The writing is then destroyed. It's about release, not reflection. Like blowing your nose into a tissue, the value is in letting it out, not analyzing it. Self-compassion and patience. Healing requires kindness toward oneself and trust in the process. At its core, this approach carries a message of hope. Your body is not broken. You have the power to heal. By recognizing the deep connection between emotion and physical experience and learning to work with your nervous system, not against it, you can unlock a path to lasting relief. Thanks for likes and sharing.